Markman. I'm a board-certified plastic surgeon here at Metamorphosis Plastic Surgery. So in my practice, my goal is to get to know all of our patients, where they're coming from, where they've been, what their goals are. So basically like to walk a mile in their shoes.
This is Radine's story.
I'm Radine. I came in to have breast augmentation done and a tummy tuck.
This past year has been especially rough on our medical personnel and first responders. Radine is no exception. She works hard as a nurse every day, but the bulk of her responsibilities are not the only things weighing her down.
The amount of the weight of the breast, the pulling of the shoulders, and that was the biggest thing, like pulling my shoulders down instead of being back, and a lot of stress on my shoulders. I have huge indentations from just the weight being pulled down.
For many years, she has had to deal with the daily pain and strain of her large breasts and regularly takes Tylenol to try to alleviate some of the discomfort from the back strain and posture problems they cause. Now that her children are older, she wanted to finally do something nice for herself to help make day-to-day life more comfortable. So she started researching her options. At the very least, she knew she wanted a breast reduction. Now, she just needed to find someone she could trust to walk her through the process. After watching an episode of Metamorphosis Plastic Surgery, she decided to give the office a call and set up her own appointment. From the first phone call, she could tell right away that she had found a place that really cared about her and her personal goals.
So next we're going to go see Radine. Radine's here for her pre-op for surgery. We're doing a big surgery on her. We're going to do a breast reduction. At the same time we're putting in implants, which sounds kind of contradictory, but the reduction's going to lift her up and make her a little bit smaller. But typically it leaves you kind of hollow at the top. So a lot of people want the fullness of the top, that nice perky youthful fullness, and that's what an implant gives you. We're also going to be doing liposuction around the waistline and the upper back, a little bit of the arms, and a tummy tuck. So let's go see Radine. We're going to go through all the details about surgery, and also we're going to do what's called Vectra. So Vectra is our 3D imaging system. Vectra is going to take pictures of her breast from all different angles. It's going to do a lift, and it's going to put implants in, and we get to choose which size implant she wants that way. So let's go get all that done with her and make some plans for surgery. Ready?
Yeah.
All right. How are you today?
Fine, how are you?
I'm doing well. Y'all ready for your big day?
I am.
Getting excited?
Yes.
Nervous?
Nervous.
A little bit of both?
Yes.
So today we're going to do the Vectra imaging. So the imaging system is going to show us your breasts, and it's going to lift them up, and it's going to make them bigger with whatever size implants you want. So you get to choose the final size that you want to have. Okay. All right, any questions about that?
No, that's the
All
part
right.
I'm looking forward to.
That's kind of the fun part.
The amount of plastic surgeons that are out there are not as qualified as he is. He's incredibly qualified.
So we're going to tuck everything up inside. They're going to be sitting real high. So initially with the breast lift or breast reduction, when you look in the mirror right afterwards, you're going to see that scar in the crease.
Okay.
Over the first 6 months, they're going to come down a little bit, and that scar winds up in the crease. You don't see it anymore.
Okay.
So it just takes some time for everything to settle in place.
My first impression is straight up first class. You walk in and they make you feel very welcome. The place is gorgeous.
Many women who get breast reductions, their number one issue is they just want the weight off their shoulders. So they're happy about patients, they just take it all, they want it
Yeah,
off.
because you have the indentations here, so.
Right. You have some
Yeah.
pretty deep dents there, so.
Yeah.
So making your breast lighter, even though again it sounds kind of contradictory, we're going to take breast tissue off, we're going to put implants in. It sounds like you're just...
No, but the breast implants are going to be under the muscles, so
Correct.
it's going not to be putting as much stress
Exactly.
here.
So your muscle supports the implant, so it's not adding any weight to your bra.
Right.
And there's even a few studies which show that putting implants in kind of helps to hold everything up so you don't droop as much again.
Okay.
Okay, we're getting rid of the weight of your breast, or at least a lot of the weight of your breast.
That's
so
right.
There's not as much weight to make it droop again also.
Making this decision because my children are older now, and I just want to feel good about myself and take away the pain. And it was, taking a lot of medication, a lot of Tylenol, and just, to reduce the pain.
So what we're going to do is take pictures from all different angles. Let me move the machine up a little bit. Actually, position's pretty good. All right. So we'll take a picture. Here we go. Hold real still.
I think the vector is very useful. You have to be able to see what you're going to look like, because it will eliminate disappointment. Whether you went too small, too big, it eliminates that. And it's also kind of neat that you can see, what you're going to look like in clothes too. I think it's going to make your decisions pre-op to where you're not regretful post-op.
Yeah.
That looks much better. This part right here, will that still be kind of, should I reduce more to get rid of that kind of, he was very adamant about safety, which was important to me.
We go through a whole bunch of things as far as the safety things that are really important to do for after surgery. Number one, stay well hydrated. So we want you to be sure when you leave the hospital, you drink a lot of liquids. That gets enough blood flow into your incisions, to your nipples, to your skin of your belly, to be sure that it stays alive and healthy. Second thing, once you get up and walk around every 2 hours, just 5 or 10 minutes, get up and move a little bit, helps prevent blood clots. So you want to do all the safety things. We give you a whole list of things to do. It'll all be written down for you.
After the consultation, I feel a lot more calmer, actually. And he is only a phone call away. He said he will answer, my calls day or night, and he gives you his cell phone number, which is extremely important.
So just finished with Radine for her pre-op appointment. So we were going to do, again, breast lift and implants. That's always the hardest thing, is determining what size implants for patients. The vector imaging machine definitely helps with that, give them a better idea of what they're going to look like afterwards. And that's the most important thing, is the appearance. A lot of people come in saying, I want to be a C cup, I want to be a D cup or double D cup. And then they look at the appearance of what's probably about that size, like, oh my God, that's nowhere near big enough. So they wind up going from a C to maybe a D in reality. So the vector helps out a lot with that. So we went through all the details about surgery, and I think she's all ready to go, and we'll see her again on the day of surgery.
This is Jordan's story. Like pretty much everyone, COVID has had a major impact on Jordan's life.
My name is Jordan Kowal, and I'm here to get liposuction of my double chin.
Between being socially distant and less active,
I'm a little nervous, but I'm excited because the double chin has been bothering me for some time, and since the pandemic I've gained a little bit of weight, and the double chin came with it, and I wanted it gone. But then I also feel good because I know Dr. Markman, and he's really good, and he'll always take care of me.
the added weight came with added insecurity. Her double chin has always been an issue for her, but the extra pandemic pounds have made it more pronounced. The thing with being at home so much, you have too much time to stare at your reflection and focus on all the things you'd like to change. Well, the new year is a time for change, and she decided she was finally ready for that change and to look her best when this pandemic is finally over. Jordan is no stranger to Dr. Markman, who she had previously trusted to perform a BBL. She loved the results and his bedside manner so much that it was a no-brainer to call Metamorphosis to help her with this transformation too.
Next, we're going to go see Jordan. Jordan's here for some liposuction of her neck today. All right, so first thing we do is make a little incision here, so we just numb that area up. All right, so while she breathes some nitrous oxide, gets her kind of in another world, we're going to inject what's called tumescent. So this little cannula's got some holes in the end. It's going to inject some fluid underneath of her skin. That contains lidocaine, which is a numbing medicine. It contains some bicarb to stop it from burning. And it contains adrenaline or epinephrine to stop the bleeding. So We put that in, wait for a few minutes to get her good numb, as well as to constrict all those blood vessels so she doesn't bleed, and then we'll do the liposuction. So all we're going to do is suck the fat out from underneath of her skin here. So there's a layer of fat between your skin and your muscle. So we're going to suck out that fat and just give her a better contour to her neck. You see how our skin's turning a little pale here already. That's the epinephrine constricting all the blood vessels. So just wait a little bit longer for the whole thing to turn pale. And then we'll start sucking out the fat. And this is the cannula we use. So the cannula has 3 little holes in the end, which suck the fat. So the fat gets sucked into the holes, and then we basically pull it out, and it gets sucked through the tubing. Alright, you can feel lots of pressure here, back and forth, but if anything hurts, let me know. Okay? Doing alright?
Yep.
Good. When we're doing liposuction, we always try to feel with your other hand so we know where the cannula tip is, so we don't damage anything that's any deeper structure. There's like blood vessels and nerves. If you're too deep, that's a bad thing. So we always feel where the tip of the cannula is while we're doing it. You can see the fat coming out, getting a lot of fat out of there. So you can start to see the contour on her right side versus her left side already.
Dr. Markman has made me feel very confident in it. He was very straightforward and told me exactly what we needed to do to get rid of the double chin and what was going to keep it from coming back and exactly how he was going to do it. And it's just a simple in-office procedure. It takes like half an hour and you're good to go and it should never come back.
So the nice thing about liposuction is we're removing fat cells and you don't make new fat cells. So the number, a little bit there? Okay. So the number of fat cells you have at the end of puberty is the same number you die with. When you gain weight, you're not making more fat cells, you're just getting bigger. You lose weight, they're just getting smaller. They don't move around your body, so wherever they are is where they are for your entire lifetime. So this removes the fat cells from this area, so once they're gone forever. And then we can pinch a little bit and squeeze the fat into the cannula, help get some more of the deeper fat out of there. So one of the common questions I get from medical students is how do you know when to stop doing liposuction? And the answer is actually very simple. It's when it looks good. So a lot of people think there's a certain amount of fat you can take out, or there's a certain point where you have to stop. Really, this is done 100% for cosmetic appearance, so you keep doing it until it looks good.
I'm excited to see the results, and even a couple weeks from now it's going to keep going down. So yeah, I'm excited to have them gone, and then they should be permanently gone after that because they take the fat cells out and then that's it. They don't come back.
So that's all about the same now. Bring your chin down for me now. Good. So next we're going to put into a compression garment. So basically anytime we do liposuction, we put people into compression to help minimize bleeding inside or minimize any buildup of any fluid inside. So this we call a chin neck bandage. So it goes around their neck and across the top of their head just for some compression. And the one thing I tell all patients when we do your neck is make sure you don't sit around like reading a book like this. I've seen patients come back with their skin all stuck together, so keep your chin up. So we just finished up with Jordan's liposuction. She did beautifully. Again, we did the nitrous oxide while she was getting numbed up. So the numbing part is always what hurts. So when we're doing the numbing, it's just usually a little needle stick before we make the incision, but then we got to inject the numbing underneath of her skin. So that's the uncomfortable part. We've had patients do it with no nitrous and do perfectly fine with that. She opted for the nitrous, which kind of puts you in the whirl. It also kind of dulls the pain. And again, she didn't even flinch the whole time we were doing that. When she was numb, doing the liposuction, again, she didn't feel anything, she said, except for one little spot, which we gave her more numbing medicine and took care of that. But she did beautifully. We got her in a chin neck bandage now to give her some compression. That helps minimize any bleeding, any bruising, any fluid buildup. So she'll wear that for probably the next 5 to 7 days.
I just got done with my chin liposuction, my double chin liposuction, and the experience was good. I was made to feel comfortable. They gave me medicine to help keep me calm and not feel anxious. They answered all my questions. The pain control was good, so I didn't feel anything. And it was about 15 minutes, and all the fat cells are out, and my double chin is gone, just like that. So yeah, it was a very good procedure. I definitely highly recommend it.
Wilson. I'm the nurse practitioner at Metamorphosis Plastic Surgery. I run Dr. Markmann's medical spa primarily, but I also help him on the plastic surgery side as well. What I do mostly is the minimally invasive part of his practice and the medical spa. So that includes injectables. A lot of people know that as Botox, which is really neurotoxins. Dermal fillers, which is kind of the injectable sides. Then we also have a lot of lasers. Every laser you can think of, Dr. Markman likes the best ones. Today we are doing an IPL session with a patient. This is her second session. She's doing it to help treat hyperpigmentation, or also known as aging spots or sunspots, and even also known as melasma. So it's just darkening spots on the skin that people want to get rid of. So we usually recommend about 3 treatments. Every 30 days you do 1 treatment, and so about 3 months later your skin looks glowing and nice. So come on in and I'll explain a little bit more.
My name is Lori, and I came in today. Brittany's been working on trying to get the pigment and the sun damage out of my face. So that's what we've been working on.
IPL also helps treat acne. It's a great tool for just helping manage it. And then also it helps with redness and rosacea because it collapses the small little capillaries in the face that people really don't want, especially around the nose and the cheek.
This is my second treatment, so I will do 1 more. I think it's a series of 3.
So we're actually prepping her face for the IPL machine right now. She doesn't have any heavy makeup on right now, but she does have some environmental dirt and stuff on it, so we're going to put a little bit of toner just to make sure that the skin is prepped prior to the laser. The great thing about IPL is that it is non-ablative, which means that you can do this and then in an hour you can go to lunch with your girlfriends. You may be a little red, but you can put makeup right over it because it's not cutting into the skin. Like there's no open cuts or anything. It's actually working from the inside out. So we're putting some eye protection goggles on to make sure that we're both safe. The laser is set at specific settings that is indicative to her skin type and what we are targeting. So again, we're targeting her hyperpigmentation, which is a little bit different of a setting if I was targeting her capillaries, and it's a little bit different of a setting if I was targeting her acne. So yeah, you can watch as we move forward. So when we treat rosacea with the IPL, it's not usually a permanent fix because our bodies are really smart. So to actually, basically in very layman's term, is just regrow the capillaries again, the ones that we tried to collapse, and it's usually good for a couple months, even a couple years, but IPL is one of those modalities that you should probably do a series every year to get the best results. Some lasers is one and done, like a CO2 where you actually is very aggressive and it's very ablative. You should do that maybe once every like 10 years. But IPL is a really, really good modality that's non-ablative, like we talked about, and you can do a series every year and you just get better and better results.
I've noticed a big difference in my face. All the sun damage that was on my cheeks and on my forehead seemed to be not as noticeable anymore.
So we're all done the treatment. It's pretty simple. So now she's a little red, which is very expected. How are you feeling?
Good.
Okay. Probably feels like a sunburn.
Yeah.
So it's a little hot. So I'll put some calming lotions on her and then just use some nice calm healing serums like hyaluronic acid. We have a dermal repair by Sente, and we have a bunch of stuff that we can provide to help just speed the recovery process. But it's not ablative as we talked about, so it's really simple recovery.
I love her. She makes it simple, easy, makes you feel comfortable.
So like I said before, you can put makeup right over top of this after we're done. So I'm just putting a nice healing tinted sunscreen that also has some hydration factors in it. And then she's ready to go back to work like nothing happened, carry on with her day, and that's it.
Envision. A profound transformation. Turning dreams into reality. Take a leap into the journey of metamorphosis. With the help of Dr. Markman and his experienced team of professionals.
About our Takeover Tuesdays. It's on Instagram. Can you tell us a little bit more about it, Scarlett?
Yes. So we go live every Tuesday at 2 o'clock to share different stories or different ideas or different educational topics that we talk about. And we'd like to invite you to join us every Tuesday at 2 o'clock.
And it's great. You can actually, it's very interactive, and I always tell everyone that you can ask any question. So even if it's off topic, we always choose a topic for the day, but if it's off topic, just send us a message on whatever you want, and we try to even include you in the whole conversation. So we'd love to see you there.
So we usually cover surgeries, sometimes personal experiences about things that we have seen, things that we have experienced. We talk about injectables, which is this lady's top thing. She's very, very good. And sometimes we have patients that kind of join us that ask questions in the chat, which is fantastic. The conversation kind of gives itself and it just flows. And then I talk about skincare, we talk about different products, different things out there. So really, it's up to you. You can kind of guide it.
My name is Dawn Baldwin. I'm here today for my 3-month follow-up. I did have a breast reduction lift, tummy tuck, liposuction in 4 different areas. Very happy with the results. Everything's healing pretty well.
Belly looks perfect. I mean, nice and flat
Yeah,
belly.
I'm really happy with
your
the
scar. So definitely a little vertical scar here because you didn't have all that and enough skin up top
That
to get
was
rid of
also
that.
where it was pierced, and you fixed that.
Right.
So
we had to cut out your piercing. That was a little wedge we had to cut above here. So.
Yeah.
So scar down here looks great, nice and thin, nice and flat, still pink. The pink takes about a year to go away, sometimes even up to 2 years to go away, but that is smooth and flat as can be.
Oh, I absolutely feel so much better. I mean, my breasts were, heavy and droopy, and now they're nice and tight and firm, and my stomach is nice and tight, and now I'm started, back into my workout and just able to do so much more than I was before, and I'm very excited about that.
Belly button scar down inside, you're still swollen in the middle here, but your scar looks great. Perfect belly button, nice little crease down the middle here. We try to give you that just a nice, youthful, healthy look.
Okay.
Maybe spin around, let's see the back. So back in here, beautiful skinny waistline. Again, scar stops out here someplace there. But you got a beautiful shape, nice full buttocks. Everybody loves having nice full buttocks these days. So that looks awesome. Up here, again, any pains, any lumps?
No.
Little tiny scar from liposuction up top here. So I do a whole upper back through that one tiny little scar. We always try to be sure it's hidden under your bra strap or hidden under your bikini. A little swollen in here still, but not much, but that should shrink up a little bit more too.
Okay.
You look great. You look beautiful.
Thank you.
So, any lumps or any pains anywhere?
I
Anything
did find
concerning?
a little lump right here. It showed up.
Along the scar line, it's probably a stitch underneath.
Okay.
They take at least 3 to 6 months to go away. So when you have the stitches underneath, your body's trying to break them down, so it does get a little hard and lumpy feeling.
Okay.
So some people get a little lump here, 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 just everywhere there's a stitch.
Okay.
And here we do a little bigger, tighter stitches, so they tend to last a little bit longer across there.
And then that'll smooth out eventually too?
It should.
Okay.
You can do a little bit of massage, help speed that up as well.
Okay.
So hard as you can, just pinch, squeeze, roll it around, move it around. That
Okay.
helps speed it up.
All right, great.
All right?
But everything else, I feel great. It's been a really good experience. I mean, it was laid out very well beforehand to my expectations. You know, I knew where it was going to be, and it really did come out exactly as I explained it. I mean, as far as the healing times, you know, the down times, what I couldn't do, they were very clear, and so my expectations were very in line with what actually happened. Thank you.
All right. So we'll see you back in another 3 months.
Okay.
The only thing you do at this point is keep on treating your scars, and the
Okay.
silicone is by far the best thing.
Okay.
Silicone oil or silicone sheeting. The sheeting's the better of the two, I think.
Okay.
We see better results with that, but the oil, definitely a lot easier.
Okay.
So keep on doing that. Since you're beyond 3 months, you can do anything you want to do. No limitations. Weightlifting, anything heavy now, you can start doing that. Just start off light and build up to what you used to do, though. Don't
I've
jump
been,
back
I've
in full
been
force.
doing weights and all of the full thing, but when I get down on the floor, I haven't been doing full heights yet because I do feel the pulling. So
Right. You
building
gotta-
up to that.
Yeah, start off slow and build up. Yeah, don't go to what you used to do right away. You got to build up to it again.
Okay.
Okay?
Perfect.
All right. Well, you look great.
And I mean, I've had such a great experience. I would highly recommend Dr. Markman for any work that you want to have done. As well as Brittany, she's done my lips and filler, and I'm very happy with that as well.
Okay, so we just saw Dawn for her 3-month follow-up. 3 months is when you typically see the final size and shape of the liposuction areas, the tummy tuck area. Breasts typically take 3 to 6 months, even up to a year to finally settle for all the scars to be hidden up in the crease again. But she's doing beautiful. Everything looks perfect.